I have worked almost my entire career with dentists who really saw themselves as healthcare professionals and always wanted to do the right thing by the patient. And so sometimes there's tough decisions that have to be made there, and compromises, of course, but not in the restoration, just in their desires.
Absolutely.
Let me back up a minute. So when you, just for housekeeping, so when you warm an adhesive, I've never asked anybody this question, but you're the guy. How long do you leave that unit dose adhesive on in the heater?
Yes, so it's important that the material that we use as optimum defel, and there is two compules, and there's two rockets. There's one rocket that has the primer. The primer has a number of volatile elements, and that's why this one should not be heated more than 15 minutes, 15 minutes. So this is in agreement. I talked to the manufacturers because I immediately informed them about our findings, and to find out if there was any problem warming up the material, which is not in the instruction for use, of course. But they said yes, the primer no more than 15 minutes should be okay, but the adhesive it's less important because the adhesive doesn't have those volatile components, so it can be warmed up more than 15 minutes. But if you take both rockets, you place them at 68 degrees Fahrenheit, which is 155, I think, the red flashing light for 15 minutes. That's what we tested, and that we found an increase in the bone strength of this specific adhesive, of about 20%, at least.
Nice. And well, that's good to know, because I talked to different people, different friends of mine in adhesive dentistry, and they'd never even heard about warming adhesives. But it totally makes sense to me. I've known about warming since the 80s.
Yes, our article was published in the Journal of Prosthetic Dentistry, I would say a year or two ago, so it's pretty recent.
Yeah, it used to be in my lectures that I did to talk about, hey, we need to think like this,